Now, South Africa has had one neonatal death linked to COVID-19. It has left many expectant parents and those with young babies with many questions. Dr. Pam Pillay is a gynaecologist, and she joins me now for more on this particular angle of the story. Dr. Pillay, good evening, and thank you so much for your time on the Pulse tonight. There have been many questions here, particularly because the research tells us those that are younger are less susceptible to contracting COVID-19. And even if they do, it's not supposed to be as harmful as it is in parents. So speak to us about this dynamic that we're seeing in babies in particular.
Okay, thank you for having me on your show. I really do appreciate it. I think first and foremost we need to do a bit of myth busting, and the most important thing is already what you've mentioned. The fact that newborn babies are generally not at risk because there's usually no mother-to-child transmission, during pregnancy. And if anything, the biggest difficulty that most obstetricians will be facing in the coming months is when these mothers go into their third trimester, where they would be more prone to premature births or needing to develop a premature baby, who may then end up on a ventilator, have a ventilator crisis, and could suffer ventilator complications and death. The only time a neonate is most likely to develop COVID infection is when there's close contact with a mother who's actually infectious, and safety precautions have not been put into place.
So if I'm hearing you correctly, you're saying that it's not transmitted directly from the mother to the child?
Not at all. The probability remains very low. We must realize that, COVID-19 is here to stay for quite a while, at least over the next year, and everything that we are receiving is based on evidence that's coming from China mainly. It's been commendable in terms of its data, its research, its ability to actually allow us to do algorithms and statistical pointouts to hotspots and individuals that would be at risk. So, it is a very, very fluid scenario at the moment, in the sense where when it comes to pregnancy and birth safety, a pregnant woman is not at higher risk in comparison with the general population. I think I need to make that very, very clear. Unless, of course, she's got underlying comorbidities. For example, being extremely obese, having severe diabetes, especially type 1 diabetes in pregnancy,